I do want to make sure that we have enough time to kind of have every one of the speakers get a chance to share. And we have, as you have seen from this conference, lots and lots of information for many people to share, but want to make sure that we don't cut the time of the presenters any further than it's been cut already. So welcome everyone. This is really the session where we're going to highlight maybe something a little bit different than some of the more technical aspects, really thinking about the different types of strategic communications and outreach that can be done on the health impacts of air pollution. And I'm actually very excited to see this really pretty diverse group of panelists, not just geographically, but in terms of the different ways that we are communicating to different audiences about air pollution and its impacts. And I think as you'll see from all of this, there's really a range of different opportunities and different kind of audiences that people are tackling in different ways. So maybe really quickly we can just, I'm gonna maybe introduce everyone at once now so that we can go quickly through later on. So here, Dr. Tian Li is here with us from the National Institute of Environmental Health at China CDC. Then we've got Pippa Powell next to her from European Lung Foundation. We've got Mark, sorry, that's not Mark. Is that Mina? Is that Mina Togi from who works on strategic communications and media, but for C40, right? Then we've got Mark, who is actually a pediatric cardiac intensivist. So really coming from the clinician's perspective, what can be done to really start to advocate and really raise awareness, I think, among his clinician colleagues, but also among the patient community as well. And then I'm really pleased to also have Eri Saikawa, who is joining us from the Department of Environmental Health at Emory University. So just to get started, I'm going to take the moderator's privilege of showing a very brief video just to highlight, again, from a different perspective, some of the work that has been done, not just to raise awareness about the impacts of air pollution for kind of a more non-technical audience, but also to highlight how medical students are also getting involved in raising awareness in their communities about pollution levels and really focusing on how they're also using local data to be able to also share about air quality and its impacts. So if we can have the first video, please.
Ini dapat berdampak kepada kesehatan masyarakat. Mengukur kualitas udara tentunya sangat penting untuk kita memberikan gambaran seberapa bersih, seberapa sehat udara yang kita hirup sehari-hari. Dan sebaiknya fakta tersebut dipublikasikan kepada masyarakat setempat. Mengetahui data itu juga menjadi suatu landasan yang fundamental untuk kita untuk membuat satu solusi, baik solusi untuk diri kita sendiri, solusi untuk masyarakat, bahkan skala yang lebih besar ya.
So again, just to give you a flavor of something very different, this was something that was done as part of the BBC Storyworks, kind of climate and health special. So there was kind of a broader global audience who doesn't know anything about this topic, but really, in Jakarta, a lot of interest from frontline health workers, including the medical students, in getting involved to really raise awareness in their communities. Now I'm going to turn it over. Actually, we're going to have a few short presentations. The first one is going to be by Dr. Tian, who's going to talk to us about really how to communicate the health impacts of air pollution and environmental risk, and really thinking again about reaching the general public about this issue. You should go to the next. Oh, okay.
Okay, it's my great pleasure to represent China, maybe to share our experience. Yeah, so I think in China, we do some, communication about air pollution and health, totally using this, 4 steps. The first one, we will emphasize health promotion and communications in our national policy. Yeah, so there is the several our national policies. I think you already know this on the first day, Professor Shen's presentation. For example, the action plan on prevention and control of air pollution in 2013, we have some, health promotion message in this very important policy. And our beautiful China planning policy, Healthy China, and the 3-year action plan for winning the blue sky war, an action plan for the continuous improve of air quality. This is a new one, 2023. I will give an example. It's very important in our Healthy China policy. In this policy, we have the Healthy Environment Promotion Campaign. Form a series of the health protection actions from the government to society and to individual and families. You can see from this slide, for the government should promote health concepts and popularize the health knowledge. For the society, will disseminate health concept, knowledge, and skills. And it's very important for individuals and families should enhance health literacy and protect awareness. The second one is we release a lot of public health protection guidelines. It's already mentioned in the first day's presentation in Professor Shen's slides, but I will give a very detailed information. The first one is a guideline for population health protection against air pollution. It's very early in 2019. Yeah, actually we released this one. It's applicable to public individuals' activities in outdoor, not only outdoor, but also indoor environment, which include basic knowledge, fundamental concept, protective measures, and skills. The next one is a heat wave public health protection guidelines in 2023, and which include even more information, include basic knowledge, main concept, protection measures for the general population, and also for the vulnerable and sensitive population. And then we release a cold wave public health protection guidelines. Yeah, and this one include a very similar information with the heat wave one. And the last one is a recently one is a guideline for public health adaptation actions to climate change, which include understand basic concept, local knowledge, adopt low carbon living habits, understanding key policies not only in China but also in the world, and focus on key population must protect the skills, which include heat wave, cold spell, typhoon, and flooding, and so on. Yeah. The third part, we actually provide some innovative prevention tools to our public. Yeah, the first one is we have National AQI Innovative Protection Tool. It's different levels, to represent the represent the air quality risk. Actually, it's released by the national TV, local TV website and apps. But now we transfer the only API to the health-oriented AHI. It includes 5 different levels of the health risk. Yeah, now this AHI tool was implemented in 27 cities, covering 183 million people. Yeah. Now we are working on the China's first health-oriented heat wave health risk early warning products. We collaborated with CMA, China Meteorological Administration. We jointly developed a health-oriented heat wave risk early warning products. This is the map for these products. We plan to jointly release this information in the summer. Yeah. The last one is we promote
30 seconds.
Okay. Promote active public participation. We organize some, health environmental promotion. We select some, typical cases. There is some, the products from the poster and videos. And the second one, you already see the, exhibition outside our meeting rooms. And the last one, I think the very interesting one is parent-child activities, which me and my daughter participate in this, very special activities. There are some brochures, and I'm in the pattern list, and my daughter joined the painting. Her name is Happy, yeah. So the last message, I think we should start, we should educate educate the kids about air pollution and health information. Okay, that's all for my part. Thank you.
Thank you so much. And it was really wonderful to see kind of how air pollution promotion is being integrated through so many different avenues of this. But also, I think we see here also the breaking down of the silos between air quality and climate, heat-related illness and cold-related illness, which is really interesting as well. So now we're going to switch gears and hear from Pippa about some of the key elements of an effective lung health prevention campaign with the example of the Healthy Lungs for Life initiative.
Great. Thank you very much. Okay, if we can move to the first slide. Do we have slides? Oh, sorry, yeah. Good idea. Thank you. Okay, that's a good start to communications. So I'm here representing the European Lung Foundation, which is a patient-led organisation. And together with the European Respiratory Society, a professional organisation, we've created an awareness and prevention campaign called Healthy Lungs for Life. It's a long-term health awareness campaign. It's really about public education. And it started because it's linked to the ERS International Congress, which is a 20,000 attendee congress that happens every year. So because this is a comms session, we were asked to be a bit innovative about our comms. So I'm going to show you a video. Unfortunately, it's a little bit of an old video where I look distinctly younger, as my son told me the other day. So here is, yeah, Mark, you didn't say that earlier. So here is a very much younger, fresher me telling you about the Healthy Lungs for Life campaign. Hopefully. So I work for the European Lung Foundation, which is an organisation affiliated to the European Respiratory Society. The reason we started with Healthy Lungs for Life is because lung disease European Lung Foundation, which is an organisation affiliated to the European Respiratory Society. It's the first thing we do when we're born. It's the last thing we do when we die. The reason we started with Healthy Lungs for Life is about cancer. They'll give money for heart disease and cancer, but often not for lung disease. I think it suffers from this perception that if you have a lung disease, you've been a... Sorry, it's really going well for me today, isn't it? Which is an organisation.
So there seems to be multiple sound systems on.
If not, I have got some extra slides at the end, which I could just do instead. We'll try again.
Can we try? Let's try again.
We did try it earlier and it worked. Last thing we do when we die. But people really don't think about lung health. They think about heart disease. They think about cancer. They'll give money for heart disease and cancer, but often not for lung disease. I think it suffers from this perception that if you have a lung disease, you've been a smoker. So what we really try to do is make people think about breathing, think about how important it is. When you do a lung function test, it actually takes quite a bit of effort, which means you have to think about what you're doing. So we wanted a really positive campaign. We wanted people to really think about their lungs and to care about their lungs and to look after them.
Sí, hemos aprendido que la salud pulmonar está muy infravalorada y que es una...
And people take care of a lot of things, but they always forget of our lungs, which is the most important organ for living. Well, air quality is very poor, and there are many diseases and bad pathogens in the air. I did a spirometry test, which I didn't even know it existed, so it's been very informative.
So that's the starting point each year for the campaign for the rest of the year. So what we do is we encourage people here at the Congress to come along, to pick up toolkits, to pick up things that they can use to take this campaign back to where they come from. So everyone may have different issues in their different countries and their different communities. So what we're saying is if you have a high smoking rate, please take all our smoking tools, go back, hold a Healthy Lungs for Life event and make a difference where you live.
We have open grants for organizations who'd like to do a Healthy Lungs for Life project, and we receive answers from all over the world, from Asia, from Africa, from South America, you name it.
The impact on the city varies depending on where we go. What we hope we can do is create a basis for activities to continue. So if I take London for an example, we really focus on clean air, and now London is really active in the field of clean air. I'm not saying we were responsible for that, but we certainly kick-started a lot of activity, brought together a lot of different stakeholders in the field to make it a key priority for them. So it's really about legacy, starting something that can continue when we leave and can make a big difference in the future. And the key thing about Healthy Lungs for Life is it's a positive campaign. campaign. We've turned something, lung disease, which is pretty unpopular, sputum, coughing, wheezing, we've turned it into something positive. You know, run a race, climb the stairs, do something positive with your lungs. And I think that's really innovative. Certainly in the lung field, we've been talking about disease for a long time. Also, we are engaging all different stakeholders. This isn't just for healthcare professionals, this isn't just for the public, this isn't just for politicians, it's for everybody. And I think in a campaign like this, unless we're addressing all those different audiences, it won't be effective.
So apologies, we finally got to share it. So I'm just going to highlight a few of the key points in hopefully the final minute or so I've got. So I think real key things about this campaign is its positive health messaging. We tried in the past to talk about lung disease, no one's interested, but let's talk about lung health, it makes the whole difference. Link it with health testing. So health testing gives people a chance to really think about their health. The test itself is quite difficult. You can try it afterwards. We've got spirometers out there. So it really allows for a conversation and engagement with the public that you wouldn't otherwise have. We were lucky because it was linked to a congress. We had really high visibility. We were in Trafalgar Square. We've been outside the town hall in Paris, et cetera, et cetera. So it's been great for visibility within a city to raise awareness across the city. We always link with the location and their policies. So when we're in London, air pollution was the hot topic. We're in Amsterdam, it was about physical activity. So linking to the local policy issue and making sure that we're in line with what they want to say. We're trying to make it fun and informative. Here you can see the iAmsterdam map from Amsterdam. We mapped some cycle routes and some running routes. We remapped them to make them healthier. We spread it around the city. In London, we did a Monopoly board. We went to all the Monopoly sites, did air quality testing, and then made a game to link to it. So make it fun, engage people. Finally, connecting with the media. Really important that we got out to the media at these big events. And again, the combination of events that we had and the people that we engaged with made that possible. As you heard, we do reach across the globe. We offer these micro grants, allowing us to do it in many different locations. Elvis, who you'll have seen here this week, he had one of our first grants. Mark is always asking for money. He's had one of our grants. So we really help replicate. It's a multiplier. It can be scaled up. It can be scaled down. You can have 1 spirometer, 20 spirometers. It's great. Not that I'm trying to sell it to you all. Finally, one solid example in Milan 2 years ago. Mayor Sala was trying to bring in a clean air zone, and we had the AAQD going through in Europe. Italy were really opposing the AAQD. So we did an event with the mayor of Milan, the president of Lombardy, who was very much against anything to do with air quality. We had a press conference. We had loads of very positive press coverage. We met with all the teams of the key policymakers. We engaged with the public. We had lots of positive outcomes. We also mobilised our healthcare professionals and patient organisations to write to those policymakers. We worked collaboratively with lots of local partners, C40 cities, Clean Air, et cetera, and as we know, AAQD did go through, again, not taking any responsibility for that, but as you heard Javi Lopez say this morning, civil society and healthcare workforce played a big part in that. So I think we've got a great role to play. Healthy Lungs for Life, I think, is a great communications tool, and if you'd like to hear more about it, come outside and we'll show you how it works. Thank you very much.
Thank you so much. Now we'll shift over to Dr. Mark Hayden, who's going to talk in more detail, giving us some examples of how health professionals themselves can communicate risk and advocate.
Thank you. And please tell me if I'm running over. Thank you for the opportunity to talk. I feel a bit of a fish out of water in a comms environment, but I guess we've learned a different way of doing things, and it seems to work. Our audience is healthcare workers. We're not aiming at the public, although obviously secondary gain with the public is absolutely fine by us, but we're focusing on healthcare workers, and the way to get them out and do something and actually engage and build, train the trainers, build committed individuals. So that's what this is all about. Just to reference the blue bag, you might have seen it earlier in the year. That really comes about. Oh, gone the wrong way. From our first ride, you can see the date on the email from Vince, who's right front and centre there. He had the idea. We wanted to do something at our hospital on Great Ormond Street to try and push Boris Johnson to do something worthwhile at COP26. So we decided to ride from our hospital in London to Glasgow over 6 days with about 70 healthcare workers. And our patients, our children, our young people, wrote on this bag, and this bag went with us all the way. It contained the message which had actually been written by Dermot Campbell-Lendrum from Geneva up to London for us prior to that. So this bag always carries a message. Since then, it has been signed by a few other people: Tedros, Maria Neira, Rosamund Kissy Deborah, a few other people, adults. We've allowed a few special adults to get on it. But that's where we started, and on the left-hand side is the rides we've organised. We certainly haven't done these things. We just provide an idea, and the theory of change is that if you go on a bike ride with someone, you fix their puncture, you share food, you're much more engaged than a Zoom. So just a few of the rides that we've done. The ULEZ ride we did around the edge of the real ULEZ. We mapped it almost perfectly, which people were very angry with me when we were walking through mud or going through some of the southern London areas where they were trying to kill us. But basically the message there was we were celebrating the fact that London was going to get an expanded zone. And the word celebrate really grabbed the press because hate or trying to stop was actually the message largely in the press. So our use of the word celebrate, maybe we were baiting them, but it seemed to work. I discovered yesterday in the mother's session that the word is love. So we'll have to move further and start talking about love of our children, love of their health. Heather Lambert's in the front of that ride, and she's not here today for reasons which will become clear in future slides. This is the ride for Ella, the first one we did last year. Hopefully we're going to do a ride for Ella later this year, probably with critical mass if that comes off. And that was to celebrate Ella's life and everything that she achieved in her life and after it through her mum. And Chris Boardman, who's a relatively famous cyclist in the UK, won lots of Olympic medals and is now the head of Active Travel England, didn't come with us because he couldn't actually do it, but did send us this video message, which I'm now going to play. And he sent us this video message because Heather, who I showed you earlier, rode from Manchester to Paris with him for the Olympics. She was the ride doctor. So I hope you can see how we're sort of weaving in engaged and active people. When you've got Chris Boardman on a bike for 7 days, even if you're a bit short of breath, you can get a lot of air quality stuff into his head. Hopefully this will play.
We actually know that air pollution kills around 30,000 people a year, a staggering number that we routinely ignore because that's how we're built as human beings. We struggle with anything that isn't immediate and very personal, which is why it takes tragedy to emotionally connect us, to make it personal. And that's why Ella's death, Ella's life, gives us the opportunity for change, to stop us looking away and moving on without action. I'm really sorry I can't be with you in person. I'm up in Scotland. I'll be riding with you in spirit and thinking about you as I go out my bike today, because it matters for 30,000 reasons and for one, Ella.
And so, that brings us to the almost present day. So this was Monday, fairly hot and warm here in Cartagena. Thanks to stellar work from some of the local hospitals and Healthcare Without Harm and Claudia to organise this, and it was technically quite a difficult organisational feat. We got a whole bunch of healthcare workers and people from this conference, some of whom are here, who rode or run. We joined up with a run and a walk. So all the methods of active travel. And we got people out on the streets, and we did so safely because we had a huge police escort, which was the first time that's almost the first time that's ever happened. Sometimes they're chasing us. And we even met the Colombian Armada, which was quite exciting, at their hospital, and they held the blue bag. So you can see the blue bag is our theme. It gives the message that we're taking the voice of children. We're not all paediatricians, but a lot of us are. And we're speaking for children because we don't think they should have to do that. If they want to do that, that's cool. But we think it's our job as adults, the responsible people, theoretically, to take that message. So that's what the blue bag's about. At the same time as our ride, you can see the people slightly with more clothes on are up in Scotland, and they're riding to the Royal College of Paediatrics and Child Health meeting. They've ridden Newcastle to there. That's why Heather's not here, and Chintika, and some of the junior doctors who are riding with them. And there'll be another ride at that event. So it's getting people out doing something active. Riding gives you hope. You get to the top of the hill, you have a bit of cake, you go down the other side. It's hard to maintain hope in the climate sphere. So use your gears. A gearbox is better than the derailleur. Get healthcare workers together, represent children, work intersectorally, use whatever mechanism you like, maybe a bike, and you'll come up with good ideas. I don't have time to talk about them today, but there's been concrete outcomes from this of the people who've got engaged. Thank you for your time.
Thank you so much. And just by a show of hands, I'm just curious, how many of you ride bicycles? So here we can kind of pay attention to quite a few opportunities for additional bike rides. And in fact, I see Beth Elliott is here in the front of the room. And in fact, as part of the Clean Air Catalyst project in Nairobi, there was really a lot of effort put together to get, again, a bike ride. Was it 2 years ago, right? Which was another great success that I think was modeled after this idea. So this gives a perfect segue, I think, into the presentation by Zarvina, because she's been working with a lot of cities around the world to accelerate actions for clean air. I'm going to talk a little bit more now about the communications and the role of local governments in doing this.
Thank you, Sumi. For those that don't know or haven't heard of C40, we are a network of almost 100 mayors working together to tackle the climate crisis. At C40 Comms, we serve to increase the power of cities to deliver on that climate action on key political priorities through building public support and also building powerful global alliances. Today, I'm going to talk to you about one of our communications campaigns called Clean Air Wins that focused on London. Clean Air Wins was a rapid response campaign we ran in 2023 to support London's expansion of the ultra-low emission zone. Our goal in this campaign was to activate the silent majority voices and also neutralize the vocal minority and offer a soft landing for ULEZ. The overarching strategy was, one, to lead with messaging that resonated with Londoners, but also making sure that we were able to make an invisible problem visible. So one of the things we did was roll out billboards across London that made air pollution visible, and it resonated with the audiences. So what you can see there is we wouldn't drink dirty water, so why would we breathe dirty air? And there's another one there with a power protein shake. Obviously, we cannot do this alone, so we activated key partners through proactive campaign interventions and equipped them with social media toolkits, graphics that they could use on their own channels to help amplify key messaging and fight mis and disinformation, as well as took out paid adverts in some of the most read newspapers. Another issue we had in the campaign was we had a lot of good data, but data is hard to communicate, data is hard for the general public to understand. So making sure that we were able to create graphics that were not only easily accessible, but also shareable. So here you can see how we worked with our creative team to deliver the messaging of the key stats on London's ULEZ. We also actually established different social media channels. So this was a first of the kind campaign for C40. One of the first things we found out going into this was our own channels did not have the audiences we were trying to target. We had what I call the climate bubble that were already bought in. So we actually activated a whole new social media channels where we could share these graphics and engage the audiences that we were targeting. And actually, just going back one more, on those social media channels, we were able to get engagement from singer Ellie Goulding, Dr. Marinera. So it was really, really successful. And then, of course, in order to give voice to that silent majority, we had to ensure that they were well-trained, media-trained. So we work with local media companies to make sure that they were able to present themselves to media, be comfortable doing media, because again, the other opposing side were a well-oiled machine in giving trainings of this kind. So making sure we were also doing the same, and that was hugely successful. Because as you can see on screen, we were able to get most of our spokespeople, and these are local mums, doctors, scientists, to be supportive voices in the media. Obviously, we are a network of mayors, so it only made sense to also mobilize that international support. Throughout the life of this campaign, we were able to secure 100 media interventions. That included not just from our C40 mayors, but also faith leaders, scientists, doctors, healthcare workers, etc. And then just quickly on our impact, the campaign was successful. So we were able to shift the media narrative. We did some analysis at the end of the campaign, as well as at the start of the campaign, which showed that supportive media coverage was at its highest ever as ULEZ was being expanded. We mobilized and activated partners who otherwise would not have spoken out due to capacity or confidence challenges. We did a quick survey with our partners at the end, and the majority responded that the campaign was extremely valuable to them. And of course, you'll know that last year, Mayor Khan was historically re-elected for a third term, with his vote share actually increasing, demonstrating that the majority of Londoners not only want strong action on air pollution, but will also vote for it. Thank you so much.
Thank you so much, Samina. So those of you who were in the plenary this morning, I think we heard about how we all need to be air pollution terminators. We all need to be air quality ambassadors. I think we've seen great examples of how this kind of work is underway, at various levels across society. And, this is something which is amazing to see how really an often complicated issue is really being translated into something which can be easily digestible by the public. And so our next speaker, Eri Sayukawa, is actually going to speak to us a little bit about, how people are working at communicating some of the more scientific and social aspects of climate change, which is often easy. Everyone here has made it look really easy, but it's easier said than done.
Great, thank you so much, Simi. So I would like to, good afternoon, everybody. I would like to take some time to, it's going to be a little bit different story. I am at Emory University, and I used to be just a modeler, modeling air quality. But when I became a professor, I really wanted to involve students in getting out there and to think about solutions. And so one thing that I started doing was to take students to the climate negotiations. So unfortunately, we couldn't send students to Glasgow, that was mentioned, because of COVID. But other years since 2015, we've been sending every single year. And what we decided to do in this journey when COVID hit was to really make the community so that we can start communicating and discussing with the experts, and the students had the way to learn things over Zoom. And so we started this seminar series or webinar series called Emory Climate Talks. And we would invite speakers to talk about their science and their policy making journey with the students. And then that led us to figure out that students really wanted to do something very creative. How could they tell the stories that are not usually told? There are so many stories that are not in the research papers, and they started to talk about what would be the means that they could do. And so the students came up with this idea of a podcast, and they said that they wanted to call it Amplifier, because there was this amplifying voices, but there was also a climate change that they were very concerned about. And that made me realize that there is so much creativity in students, and I am nowhere close to teaching about communications. But what I realized was that if there was a combination of science and engineering and different knowledge that can come together, and the students being able to creatively express their what they are learning, that was really powerful. And so if you go to the website, you will see different ways that students created to talk about what they learned from their research into the ways that public can understand. And so then we were very fortunate to be able to do the communications in this conference. I hope that you've been following the app. Every single day you would see the daily recap video. And so that's actually created by the students that I've brought. I have 9 students and 1 staff in this conference, and 6 people have been on the communications team. And I hope that you would enjoy what they produced. But I think what's really important is that it's not just media, and I feel that we don't really talk enough about the science. And without that science part and the health and media coming together, if we don't collaborate and if we forget about the technical details, I don't think we can get to the next level that we would like to get. So my really hope for the future is that how can we really train the next generation of students that's really, really wanting to be a part of the solution. And I hope that we can use this time to discuss some of that. Thank you so much.
Thank you so much, Eddie. And I think this is such a wonderful opportunity for your students and also reflects, I think, the spirit of this particular conference where we've really seen much more active engagement from civil society, from academics and different implementing partners in addition to the government partners. So this has been, just again, really exciting to see the different examples here from the different panelists about really communicating about air quality and its impacts. So I have just a couple of starting point questions, and then would also love to kind of more quickly bring this into having the audience also in the discussion, because we don't have a huge amount of time given the changes that we had earlier today. So I guess we saw some examples already from Zermina, but other thoughts from the panelists about how we can make air pollution and particularly energy access issues more tangible and urgent for either policymakers, the general public, or for particularly vulnerable communities. And if you have any examples of particularly effective communication strategies that you've used, would love to hear more about that. Pippa?
Yeah, so at European Lung Foundation, we work with patients, so people living with lung disease. And we first started getting involved in sort of clean air, I don't know, maybe 10, 12 years ago, and really patients just didn't seem interested. So if you said to an asthma patient or a COPD patient, what are your thoughts on air pollution? They would just go, well, it doesn't impact me. So it was really hard to engage. It was really hard to have conversations. And what we found is as the data and the science became clearer, and this is where we have a real advantage that we work with the European Respiratory Society, because the moment there's new research on the topic, we're able to then make it available for patients and make it lay enough and have conversations about it. And we created an air pollution and climate change working group, so a group of patients who were interested. And then we found out what had really resonated with them and why they'd started to get engaged. We started recording patient stories, and we've now got a series of, we call Breathe Clean Air conferences. And we found that interest has grown because people are starting to understand it and say, okay, I'm having an exacerbation because of the air quality, because of outcomes of climate change, etc. And we're starting to build this really interested, really perhaps future advocate groups. I mean, I've been really inspired here by the mums working with kids and parents, and I think we'd like to see the same with the patient community, that we can get them to that stage where they want to be heard and want to have their voices seen. And I don't know if anyone saw our chairman, Dimitris Kontopidis, in the opening ceremony, but again, he's never really linked his symptoms, day-to-day symptoms of cystic fibrosis, to air pollution, but having moved to an island can see that's a massive impact, and that's really brought him up to the advocate stage for clean air.
Okay, actually cold is a kind of risk factor for cardiovascular diseases, and we collaborated with China Cardiovascular Association developed the code-related cardiovascular risk early warning models, and they released it's the information on the WeChat, the WeChat platform to the patients. Yeah, I discussed actually with Kelsey this at lunchtime. Maybe in the future we can promote this, this kind of information during the platform of WCHF. Yeah.
And for those of you who may not be familiar, WeChat is the Chinese version of WhatsApp that's used widely by people there.
Just quickly for me, it's as Pippa said, is make it personal. People resonate with personal stories. So one of the things that worked with the Clean Air Wins campaign and other campaigns that we've run is showing personal stories. So a mum taking her child to the hospital because they're having asthma attacks really works. And then also use hyperlocal data. So projects like Breathe London, where vulnerable communities are able to see the air pollution in their very neighborhood, makes it feel a lot more urgent. And then the other thing I'd say is always engage through trusted voices. So people are more likely to believe their neighbors, doctors, scientists, mums, than politicians. So make sure you're using the trusted voices so you're reaching the right audiences.
Yeah, I mean, as I said, our audience is healthcare workers. So the types of healthcare workers and the types of people is going to then determine who they're then speaking to. We didn't do it consciously, but we were very aggressively diverse at the beginning. This could have easily turned into a bunch of middle-aged men in lycra cycling on carbon fiber bikes and all competing on Strava, which some of them did, but I actively discriminated against most of them, apart from my CEO, who was quite useful. So we had a very diverse ride up to Glasgow, including people who'd never. One of the riders didn't realise it was in Glasgow, so she got a bit of a shock, but she was fine because she was on an e-bike like me. So we're diverse on bike type. And e-bikes are very inclusive, and they don't all have to be carbon fiber races. We're diverse on human type, if you want to use that, but also on profession. We did have some consultants, but we had physios, we had estates people, we had the whole range of healthcare workers, and we really stick to healthcare workers as a term as opposed to professionals, and we try and avoid doctors. I had to take it out of one of the slides that somebody else, or one of the things that somebody else produced for me earlier. So I guess that's how we do it. We make sure that our individuals and the places that we're reaching out to as much as possible, although really you saw from the map, Africa's a difficult place to organize a ride. Hats off to the Nairobi group. We understand that there's different risks in different areas, but that's how we've done it, by actively being diverse from the beginning and then hoping that cascades to diverse ideas, diverse interactions, and diverse communities.
I think one of the things that we did that I think was slightly successful was to set up the air quality sensors in schools so that the middle school and elementary school and high school students got really excited about the data, and then they will tell the parents and the grandparents about air quality. So I think I've read research somewhere that the teenager females talking to the parents and grandparents is the most effective ways about climate change. And so I think that can also be the solution for air pollution too.
And thank you for bringing up that issue of using data for communication. I also wanted to ask the panel one more question before we open it up to the audience, which is if you've ever dealt with situations where you had to consider how to address misinformation and misunderstandings about air pollution and its impacts, and if you have any kind of wise words of wisdoms from those experiences.
I don't have wise wisdom, so I will go first. And then I can pass the mic. I think it's really important that, as what we can do with the low-cost sensors, because the low-cost sensors are great, but they're not the most accurate. And so how can we communicate that? And then so that what we do is to co-locate the sensors and then create the bias correction models and talk about how we can do that in the most effective way. Hopefully, that's useful for people, but talking about the process scientifically in a way that's understandable, I think that's very important.
Yeah, I mean, we've done some professional development for the people in the group, and we've had talks from Rachel Aldred and cool people like that about local low traffic neighborhoods and things like that. But I guess we just do it while we're going on bikes or having breaks or whatever. It's building confidence in each other, bouncing things off each other, also being around when somebody's talking to a member of the public or somebody else, and then not formally, but oh, that went wrong, whatever, learning. And that's how healthcare workers do a lot of stuff, actually. We have to do mandatory training, but none of us are awake. So I guess that's how I would address it, that we try and build resilient and confident individuals. And we certainly have, we've had people become Labour councillors because they said, well, now I'm confident enough and I know what I want to talk about. So I guess that's how we go about it. And only one of our riders pulled out on the ULEZ ride due to a death threat, although they were the only person who had a death threat. It was a rubbish English death threat, and the person had used their own phone, so they got arrested. It wasn't a proper, proper one. So I'm certainly not, claiming anything there. But our interactions with drivers or whatever are almost invariably going about people who've suffered disinformation. And I guess we're trying to use our healthcare voices to be able to argue back about that in a way that works. And I suppose we're often in positions of some sort of conflict with our patients. So I guess we've got some of those skills. It's just repurposing them.
I think dis and misinformation is probably the greatest challenge we face as communicators today, not just in the climate space, but across the board. And actually, the Clean Air Wins campaign was a countering disinformation campaign because it's something we faced a lot in London. I think the top thing for me is, again, like going back to those trusted messengers, because people don't trust politicians, and there's trust in scientists, but you're more likely to believe what your neighbor or the WhatsApp group or your next door app is telling you than you are what you see on TV. So one of the things we did in that campaign was mobilize faith leaders so that the messages were really going across to communities, and working with the right partners who had the trust in those grassroots groups to deliver that message. So I think countering disinformation is really how you're reaching those audiences, because sadly people are more likely to believe a random video that they're sent on WhatsApp by their friend or someone they trust than they are what they see on the 9 o'clock news.
Yeah, maybe 2 points from me. So first is these patient conferences that we've been doing has been a great way to educate, because the conferences are designed by patients, but we have professionals there, both epidemiologists and scientists and doctors, to answer questions. So people can post questions throughout them and we will answer them live. And I think it's a great way for people to really, ask any question that they want and we'll answer it. But they are already engaged people who are interested in coming to the webinar. We have just started a TikTok channel, much to my disbelief, because I'm too old for all of that. So, but that's one thing that we've done because of misinformation, because we know that if you're not out there putting the correct information out, there's 100 people who are. So, yeah, unfortunately, we're now on TikTok. So, follow us.
Okay, I have 2 points. The first one, I think that we should, for the government, we should release the official information, like our guidelines, for air pollution, heat wave, cold wave, and climate change. This is a professional and official information for the public. It's the first point. The second one is, I agree with them. Actually, people need a person they very trust. For example, like my parents, I told them it's very hot in the summer. You should turn on the air conditioner, but they didn't because they don't trust me, but they trust their doctor. If doctor told them, they will turn on at once, I think. So I think if we want to tell the patients, we should train the doctor first. Yeah, climate change in the house, air pollution in the house. That's my point. Thank you.
Thank you. So now we have just a little bit of time left, but I did want to open it up to the audience to see if anybody has any questions or thoughts. I see 2 there, and Do we have somebody who can help with the microphone? Thanks, Paul.
Who's first?
Who's first? I didn't look this way and that way, so pick some. Are there any hands up?
Yeah.
Okay.
You can
There's.
All right,
Okay,
good. I'll be back.
Tanushree, and then pass it over.
Hello, I'm Tanushree. I run something called Air Quality Life Index. So if you've seen stuff around how many years of your life you're losing because of air pollution, that's us. So hey everyone, we have a booth, come check it out. Anyway, my question is very interesting examples. And we heard a lot about engaging people in the discourse of air pollution. But I want to sound a bit meta and philosophical. How do you get people to go beyond engagement and care about air pollution? And how do you measure that care, right? Engagement could be measured through likes, shares, tweets, subscriptions. But how do you measure whether or not people care about air? That's one. And the second one, which is probably a little simpler, which is how do you sustain engagement? I come from India, and every year you see pollution getting really bad. There is a bit of melancholy that kicks in because the problem's not getting solved. So how do you sort of use that disappointment and sort of sustain engagement? So yeah, those are my questions.
Thank you. And just to kind of add on to that, I think in the spirit of thinking about public air quality, this is something which has definitely come up in terms of how we communicate about air quality levels when you do have kind of sustained episodes. Because just to say, like, today the air quality is horrible, and yesterday it was horrible, and tomorrow it will be horrible, is not actually very helpful in communicating. And so that's definitely something we need to think about as well. Pippa, go ahead.
I've just forgotten the first question. What was the first part? I'm showing my age. Sorry. Caring.
How to show.
Oh, how to show people care. So for us, it's been quite an organic kind of journey with people sharing. As I say, right at the beginning, patients didn't seem to engage at all. They didn't see it was relevant for them. They weren't interested. So one was information, getting them to understand that it was impacting them and that their exacerbations and that, their symptoms were from air pollution. And then engaging them, giving them opportunities to speak, and whether it's in a conference, whether it's quoting in a publication, whether it's giving them visibility. And then our chair being here on stage, he's just a guy with cystic fibrosis. He is blown away by the fact that he's been at the WHO and he's been on the stage. We have a youth, he's 16, he's got bronchiectasis, he's really impacted by air pollution, and he was part of Elvis's Young Leaders remotely on Monday. So these people are starting to really get engaged at higher levels, and then as they go up, they're really seeing it as impacting their lives, and they're able to commute. So I think we can see it really organically, how people kind of get further and further engaged. Keeping them engaged, I don't know. I mean, I was talking to Rosamund this morning about how depressing it was a little bit, saying the same thing over and over again. Again, I keep talking about my age today. I was at the first conference, and there is a difference from the first conference. The conversations are different, and I think we need to communicate that back to people and say, it's slow, it's painful, but there is change happening. And hopefully, the more and more people who get engaged, the more positive we can be.
We've got a question behind. Maybe we'll take two questions. George, Kelsey, and then, oh, sorry, there's one here as well. Okay.
Shall I go?
Yeah.
Hi, everyone. I'm Maya with Our Kids Climate. So we are a delegation of mums that are here telling our story from a mother-parent perspective. Thank you, Pippa, for mentioning us. I completely agree on the power of storytelling, of personal storytelling, and on the trusted messengers. And I think the study that you refer to, it actually showed that it was the most effective way to reach small c conservative fathers was through their daughters. So I think, we need to understand, who the audience is and who's best placed to deliver the message. What I also wanted to just add in terms of strategies that have worked really effectively for us in many different countries is firstly working with artists and illustrators and creatives and making that connection with art and culture. Just like storytelling, we know that moves people and that can make an issue feel very real. And the other one, which is a bit sensitive, but I think there's a space for it, is to really use humor. That has to be done carefully and sensitively, but we're seeing more and more of that in the climate space, where groups are collaborating with comedians and are trying to to use humor because it breaks down barriers, and it's again another powerful communication tool that needs to be used with care but can be hugely effective. And thank you for the great panel. It was such a brilliant discussion, and to WHO for giving so much space to civil society to be at this conference.
Thank you. So we've got 2 questions. Maybe we'll take both the questions, and then if there's any response, just in the interest of time. I think George, Kelsey first, and then you right after.
I just wanted to, as this wonderful discussions about how to engage the public, but health professionals can engage directly in the policy. So, but I think that many are too reluctant to do that. And there's many calls for this, a need for health professionals to step in, like at hearings, and work with places like Sierra Club, Earth Justice, and they're starving for experts who are willing to say, yes, air pollution does kill people, and yes, there are effects, and this proposed pipeline is going to have these effects, or this power plant will have these effects. And and I've done this over the decades, and it's very gratifying because I can list to you over a dozen coal-fired power plants. I discussed their health effects, and they are no longer, I'm here, they are not. And that's a wonderful feeling. And I testified recently on 2 pipelines, 2 natural gas pipelines, talking about the health effects. Both denied. Those pipelines are not going to be built. So I think there's a lot that health professionals can do, but they seem very reluctant. They're always having trouble getting experts to state the obvious, that more pollution is bad for you.
Shall I take that?
Okay, sure.
I mean, we don't have social media. We don't want social media, and we're certainly not measuring clicks. But we're trying to get engaged clinicians and give them confidence, whether that's speaking to the public, whether that's speaking to courts. I mean, we go to court, don't we? We go and see coroners, and we have a nice little chat and everything. So, we've already got a bit of a head start there. I mean, Heather and myself were thinking about how do we do that. We thought maybe client, we didn't really know where to go. So maybe afterwards you could give me those names that you mentioned that are looking for people that want to do that sort of thing. So, but I think it's not unreasonable for doctors to be underconfident about this. We didn't get any training in medical school. Unlike yourself, we're not experts in it. We're getting there, and you need a group of people who are going to have your back and going to look after you. You need a community there. So I guess that's perhaps my answer as to how we would approach building that. It's not just about necessarily running courses. It's not as simple as that. You need people who have a shared identity, and we need to build that in the healthcare community, and it shouldn't just be doctors either. That would be the best answer I could give.
And just before we turn it to Kelsey for the last question, I just wanted to emphasize it's true that we really do need to continue to have more emphasis on training medical students in a more robust way so that they do already start to get interested and confident about advocating and communicating about these issues.
Hi, everyone. My name is Kelsey Armstrong-Valenchuk. I'm from the World Heart Federation. I echo the thanks to the panel, to the WHO for giving us the platform. I am a little bit aware, though, that at these wonderful conferences, there's a slight risk of preaching to the choir or, communicating in an echo chamber, if you like. So my question to the panel is, are you aware of that risk when you're designing your communications campaigns? And if so, how do you actively work to break out of those silos? Thank you.
Thanks, Kelsey. Absolutely, for us, very aware of that. And, audiences are at the heart and at the start of everything we do, which is why in the specific example I gave, we actually created new social media channels. I think Maya mentioned this earlier, but we always try to work with messengers like artists, actors. I'm going to name drop, but recently we got Leonardo DiCaprio to back the ultra low emission zone. But these things have cut through, as you say. So it's really important to make sure that our messages are diverse. So going into the artistic communities, but also, as Pippa was saying, like making sure we are on channels where people are. So TikTok is hugely popular. Video content is hugely popular. So taking that into account when you're looking at audiences.
Maybe I can just add, I mean, you saw yesterday, Kelsey, at Healthy Lungs and Heart for Life in the park. I mean, we had people, and again, this is where the lung testing, the health testing, I think, comes in. People are just really interested in getting a free test, right? And the people who are most interested in getting the free test are people who know their lifestyle is perhaps not how it should be, and that they may have issues or symptoms. So we get a lot of people coming who would never go to our website, who would never go on our social media channels, but are coming for a free lung test. And while we've got them there, while they're doing the test, we can talk to them about these issues and talk to them about what we want to talk to them about, as well as kind of helping them with their health problems. So that's one thing that I think is inherent in the campaign. And the second is using social media advertising. So really kind of, we had an occupational tool, which is not quite on the same thing, but we set up an online kind of quiz where you could find out if your workplace was damaging your lung health. But we use channels such as, hairdressers, advertising to hairdressers and mechanics, and just thinking out of the box in how you get to those audiences that aren't your usual. Because I completely agree, we often talk to those who are interested. Yeah.
And it is interesting thinking about the reflections from the earlier conference that we've come a long way, I think, in raising awareness about air pollution and lung health. And I think, really happy that World Heart Federation is kind of leading the charge as we really think about continuing to raise awareness about cardiovascular disease as well. So we're actually out of time, but if we have one last intervention from the front of the room, let's go ahead and do that, and then we're going to have to continue our conversations, separately.
It's just really to carry on from the last point a little bit, and also for clarity, I work for Pippa and Health Lungs for Life. But I think one of the ways that you can really start to reach new audiences as well is to stop trying to take ownership of campaigns and to actually work with other communities, make toolkits, make it really easy for people to go take our campaign, run it themselves. We're doing Healthy Lungs and Heart for Life. It could be Healthy Lungs and Liver for Life, Healthy Lungs and Brain for Life. It doesn't need to be owned by these big organizations, and that's how people can really feel ownership of the communication and engage their peers. And I think that's really important. And I'd love for NGOs to sort of hear that moving forward.
And I think that's the best way to kind of end this session, because we've been thinking a lot about open data, but I think also open materials that people are able to adapt and share is going to go a huge way in terms of really increasing awareness on a global scale, which is what we really need. So with that, I think, unfortunately, today has been a tricky day for timing, but, would really just love to thank all of the panelists for the amazing insights and experience that they've shared, and also for the audience for being really, also keen on hearing more about this and sharing your experience as well. Thank you.